Have you already heard from the doctor about your port being placed?
Yes.
Okay, when is that gonna happen?
So it was supposed to happen on the 27th, but they didn't do it because I'm supposed to be waiting on a fertility doctor.
Okay.
No fertility doctor has called me yet, but that was supposed to happen sometime this week.
Okay.
Then it would have started on the 31st for chemo.
Yeah.
But since Beer Hooray said that
you have to talk to the
fertility doctor
first,
before
yeah.
that, it won't be starting then. So I have no idea when, but he just said he never really specified a time, but I was guessing probably like a couple weeks or something. I don't know how that works.
So let me give you the fertility doctor phone number that we referred you to. So just in case if you don't hear from
give them a call. That's what my mom was saying today too.
You can do that.
Give them a call.
And then, so I had kind of made you out some makeshift calendars because the treatment that you're on, it's not confusing. It's just a lot to kind of do. But since the date's just going to change, you can just kind of like push it down or whatever.
Right. I understand what you're saying.
So it won't be exact date, basically.
So what is this, like, basically, like, are you preparing me for chemo?
Mm-hmm. Yep, I'll give you all the information you need, kind of what you need to do, what to expect, and everything.
Okay.
So that's what we're here for today.
Okay.
And so I usually like to start out with kind of when your port's going to be placed and all of these things.
Right.
So this is the fertility doctor. It's called Midwest. Do you have children?
One.
Okay. How old is your baby?
7.
Oh, well, not a baby.
Yep. 7 going on 17. She's a grown woman.
It was fertility. She referred you to Erica Will. He referred you to. Okay. So this is their number. You can give them a call and just say, hey, I just wanted to, we referred you there. Dr. Big already referred you because you're going to start chemotherapy and you want to kind of discuss it, and then they'll kind of set you up with an appointment. Probably once you leave here, they'll also do the same thing as well, but just so that you have the number.
Okay.
So we will kind of go over everything and then kind of go from there. Okay. You have any questions right now? No. Okay. So they're saying they wanted to wait till after you talk to the fertility doctor to actually get your port placed as well?
No.
What did the doctor say about the port?
I gotta go out of town tomorrow, and tomorrow was my port placement. So
okay.
I told them if I'm not getting it, then maybe they could push it back because I gotta go out of town anyway.
Makes sense.
Yeah, for the weekend and stuff. So no reason to do something like that when I know that I'm not starting chemo on the 31st.
Okay, so we'll go over everything and kind of go from there. So this first page is just a letter to you from our practice. Dr. Beer Hooray is your doctor, so typically you won't see any other doctors in here. You'll typically only see Dr. Beer Hooray. Occasionally you'll see some of the nurse practitioners, but usually you see Dr. Beer Hooray. Okay? Sorry, no other doctors. Sorry about that. This page kind of talks about tips for your chemotherapy appointments. So usually we do the chemotherapy in that infusion room. It's right back in the corner. So typically what we do is just because...
so chemo is here too?
It's in here. Typically it's in here, depending on whatever your insurance says. Sometimes your insurance will make you go across the street to the hospital. But typically it's here. Okay? So once you get your port placed, do you know what a port is? Have you ever seen a port before? Yeah. You have? Okay. So once you get your port placed, that's where your chemo is going to go in your port. It's the central line. They'll be able to access your blood and all that stuff. your port will be in your chest here usually. So typically just wear something low cut so that they can get to it. A lot of people will wear like a tank top and then a sweater over it so they can get to the port. I sent you in some lidocaine cream. That's what you can use over the top of your port site. So basically what you do is you put a little bit on there before you come in so that it's not, so it can numb up the area so that when they access that port with a needle every time you come in, it's not as painful.
Oh, wow.
Yeah, so I sent that to your pharmacy already. It kind of talks about just, things you can bring to your appointments. You can bring anything you want in that infusion room with you. So your treatments are going to be between 3 and 4 hours, so you'll be here for a little while. So you can bring books, cell phones, laptops, blankets, whatever you want to bring. There's an extra chair if you wanted to bring somebody else in that room with you. So if like your mom or somebody wanted to come with you, they don't have to stay the whole time. They can come in and out, whatever you want to do. But there's a chair for them if they wanted to be there as well.
Why is there a must that someone comes with me?
It's not necessarily a must, but on your first treatment, I would, just because you just never know how
it's going to go. Okay.
Yeah. Some people come by themselves and they
because like I live here in Indianapolis by myself. My family is going to have to come from Illinois, which is not a problem, but it is a problem. I don't want them coming down here just to sit for chemo with me for 2 or 3 hours. Like, so I didn't know if it, and then they saying it like you have to have somebody, like it was a must. Like if I didn't have a person with me, I wasn't gonna get chemo type.
I would just kind of, the first time I would for sure.
Oh, and it is, and they'll be there for the first couple of weeks,
Yeah. And then the second time,
see how it go.
If you felt good the first time,
then do it like okay. So it's just kind of like you would want to have someone there and then go.
It's not a must. People come by themselves all the time.
Yeah, because my aunt said she did her chemo.
Yeah, some people come by themselves. They fine. Usually it's a few days after chemo that you start feeling
right.
Feel.
Okay.
So that's pretty much it. Okay. So this page talks about just general side effects of chemotherapy. Your aunt had breast cancer too, or a different kind of cancer?
2 of them.
Both of your aunts had breast cancer. Your mom too, or no?
Grandmother.
Yeah. 2 of your aunts, and but not your mom.
No, my mom passed from unnatural causes.
Okay. So this talks about just the general side effects of chemotherapy. So your aunts probably kind of told you. What kind of things have they said to kind of look for?
Everything. But not just my aunts. I've talked to a lot of different people. Not a lot of different people, but a few different people. Everybody got their own stories. Like, for example, I was so dead set on, that some people would say how they had lost hair and didn't lose hair. And then I was like, okay, so it's a good chance. But then when I had talked to Bir Hooray, and, he was in there with the meeting with me and my parents, and my dad had asked about my hair, and he was like, she's going to lose her hair, like 100% going to lose her hair. And I'm just like, dang, how did everybody else, have these different stories? So you got to think
that sometimes people are getting different treatments.
Exactly.
Yeah, some people are getting different
treatments. And then I had one aunt who had breast cancer who didn't lose her hair. Then I had another aunt who had breast cancer who lost all her hair.
Yeah, so it's kind of hit and miss. You can be optimistic, just think like, hey, if I lose my hair, this is what I'm going to do. If I don't, this is what I'm going to do.
And that's what it is. Like I told my aunt yesterday, I'm preparing for the worst but hoping for the best.
Exactly.
And that's just what it is. Hair is hair. I have my life, so I'm not complaining about it. It was just like,
but as a black woman, kind of hair defines us. It makes us who we are.
Yeah.
Just like our breasts kind of make us who we are. So it's all connected. So it affects you. You're valid in what you're feeling. So.
And I've always had hair, so it's like,
and I can tell you got a nice grade. So.
Yeah, I've always had it, and it's like I'm not worried about losing it. I feel like it'll grow back.
It's gonna grow back,
and I want to experience. I've never experienced short hair.
Yeah.
I've always been afraid to even get a trim.
Yes.
A little cut. I'm 32 years old. I don't even want nobody to trim on it. It's like, what? Actually, I think I'll get a dye. And play in it until chemo.
That's exciting.
Yeah, that's what I said. So my dad was saying, like, try and get the cold cap that Bir Hooray had. He said that
there's people that recommend it. There's people that say
I don't care about it.
Yeah.
Nope, I don't care about it.
It's expensive, and somebody has to be here at the infusion. Somebody
to
has
keep
to be
on doing that.
You have to switch out the ice every 30 minutes.
Yeah, type of thing. And, it's not even that. Like I said, I think I'm excited about this making me do a change, something that I would have not done, with that. So, yeah, I'm not, but I was saying all that to say, I see now that there's different stories to different people, different chemos, different
So the fact that you're acknowledging that there's different stories, That way, when you have your own story, you'll be okay. Because a lot of times people will hold on what other people say and be like, "Oh shoot."
Yep.
Now you know it's like it's different stories
Yep.
with different people, and it just depends on who you are. So
I'm so glad my dad had asked about the hair because I had just assumed because I heard other people say it that it was like that. But for him to say 100% and then to see him like on these walls, that man know what he talking about.
Yeah, he know what he doing.
He had seen something, and it's a reason why he said, just prepare for it. You know,
exactly. And if you don't, it's okay. But if you do,
I'm
moving on.
for it,
And I'm prepared.
Yeah.
Okay, so let's talk about the general side effects of all chemotherapy. These are the ones that people mainly talk about outside of the hair loss, okay? So up here is our nurse triage number. So say you needed to get a hold of Dr. Bigare, you need to get a hold of the nurse practitioners, or for whatever reason, this is the top number that you would call, okay? Monday through Friday, 8:30 to 4:30. After that, if it's a weekend or holidays, you can call us here. If you run out of your medications, you need anything, just call us, okay? The number one side effect